All right. Well, welcome back, everyone, to our afternoon keynote session here at our 2021 Colorado State of Reform Health Policy Conference. I appreciate you making time. We got up to about 274 folks registered to be with us here today. So appreciate people coming in at the last minute and being here with us. I see we're over 200. We'll probably get close to 250 in the room here for this show. And of course, for this keynote conversation. And of course, all of these will be recorded and available to you as attendees. You can come back and watch all of these on demand whenever you'd like and visit some of those sessions that you maybe didn't make. So without further ado, I want to rattle through our introductions real quickly and then just jump right into our conversation today here, talking about the sort of state of play in health policy and legislature in the legislature and looking ahead to the next session. First, we have Senator Rhona Fields, who is the chair of the Senate Health and Human Services Committee. She's joined by Senator Jim Smallwood, of course, who's the chair of the Minority Caucus in the Senate. Representative Dafna Michaelson Jenet, who is the chair of the House Public and Behavioral Health Committee, and Representative Matt Soper, who's vice chair of the House Committee on Legal Services. I appreciate all of you guys making time to be with us. Thank you. Senator Fields, let me just jump in with you. Let us know, give us an insight or a window into the stuff you are tracking and thinking about when it comes to health policy. Where does your attention go when it comes to healthcare these days?
Well, I can tell you that health policy continues to be a hot topic under the Golden Dome. It's been a hot topic, I would say, for the last 6 years. And I think a lot of that has to do with the governor making sure that that's a high priority for him as relates to making sure that access and affordability is important for the state of Colorado. So when I think about the work that we just did this last session, I'm really proud of the bold policies that we were able to pass. Overall in the session, we introduced 623 bills, 540 bills were passed, and 4 bills were vetoed. And the ones I think I'm most proud of is a bill that deals with health disparities. Because with COVID-19, we discovered that people who are Black and Brown were exposed to a high percentage of deaths just based on a variety of different circumstances. Maybe they're frontline workers. Maybe it's because of the environment that they're living in, condensed quarters and those kinds of things. So we passed the bill. It was Senate Bill 181 to make sure that we create an equity lens in every department that reports to the governor. So that means labor, that means housing, that means public health. Just everything, everyone has to have a goal that addresses disparities as it relates to health. So that's important. We also dealt with prescription drug pricing. We did the public option bill. Of course, my colleague is going to be talking about public health. She's been a champion in this field for a very long time, so I'm not going to take away her thunder on that. But I can tell you that healthcare policy will continue to be an issue of concern. So moving forward, and also opioids. And we just did so much work. And I'm excited and proud of the work that we accomplished. When I look at next year and the things that I'll be looking at is to how we can move beyond COVID-19. Now, we're still in the midst of COVID-19, but there still are some lingering impact as it relates to learning loss, as it relates to behavioral health, as it relates to people losing some of their jobs and women not back in the workplace. So those are some of the things I'll be looking for champion as we go into next year to continue bold policy as relates to healthcare.
Senator Smallwood, Senator Fields has a list of things she identifies as accomplishments from the last legislative session. As someone from perhaps a different perspective on the session, how do you categorize this time in health policy and healthcare reform? The 2021 session leading into the 2022 session, is this time similar in terms of energy around healthcare in your career, or is it different? And if it's different, how so?
Well, generally speaking, DJ, I would say that health policy in the state of Colorado, by and large, has been nonpartisan, at least for the first 4 years that I served. So these were issues that I think people on both sides of the aisle could agree on. A lot of it was around transparency, right? Transparency conversation around pricing in primary care physician's office, in freestanding emergency departments. So there was a lot of work that I think we did where both parties, both chambers got together to do a lot of really good stuff. As of late, I would say, there are just some ideas that are probably a little bit more partisan one way or the other. You heard my colleague mention, like drug importation, for example. That's something that President Trump was a big fan of. Governor of Florida was a big fan of. So there was really partisan conversations to some extent around that. Partisan conversations around the public option, which turned out to not be a public option, mercifully for the citizens of Colorado, but it did bring some conversations, at least around health disparities, health equities, which I think is important. So by and large, I think it still remains something that both parties, both chambers get together with to work on. Those big issues. Substance use disorders is still one. All you have to do is drive around our great state to realize that we still have an enormous problem around that in our state, particularly in our urban areas. So we're looking forward to working together next year on ideally ideas that again, like in the past, both parties can get together and support.
Representative Michaelson Jenet, I know there are some big topics in legislative politics that cause some division, but public option, et cetera. But on on the topic of public health and behavioral health, topics that maybe were a little more separate, but certainly I think now more integrated in this pandemic time. Are you finding that the issues in your committee are generally speaking a little more bipartisan in nature, that on the general topics of behavioral health, for example, on the general topics of public health, that there is sort of strong bipartisan wind relative to some of the other more polarizing topics in the legislature?
Absolutely. And I invite anybody to come and visit our committee. At the beginning of the legislative session, the committee had a conversation about what our values were and why we were here at the table to work on public and behavioral health for the state of Colorado. And almost to a member, everybody mentioned behavioral health as something that is of significant importance to them, to their families, to their communities. And because of that, we were able to have really incredible conversations. Does that mean that every member voted yes on every bill? Absolutely not. Because that's not, I mean, if you're getting all yes on all bills, then something's not right with your bill. So, we had rich conversations and dialogues around marijuana potency caps. We had conversations around the bill that I'm most proud of passing. And if I remember correctly, Senator Smallwood jumped onto this bill in the Senate in the 11th inning. Is that a thing? There's no 11th inning. So it was annual mental health wellness exams, which now are part of the essential health benefits package offered here in Colorado. And trying to bring about things like parity. So there's a lot of middle ground to be had on the conversations that we're having in public and behavioral health. It's never going to be a slam dunk, but we are all working hard, and I believe that our values are in the right place.
So, Representative Soper, let me ask you, as a relative newcomer to the legislature, have you found the bipartisan nature that's being expressed here, did it sort of meet your expectations? Were you expecting maybe that it would be a little more divisive as you entered in the legislature? And I wonder if maybe the outside pressure from industry groups is perhaps a little more pressure than some of the kind of partisan tensions. I wonder what your thoughts are on both how partisanship has met your expectations or not, and then the pressure from the outside on you all on the inside.
Yeah, thank you, BJ, and it's great to be here. I felt the partisanship to be little bit more ebb and flowing than perhaps how I viewed it from the outside. I mean, if you look at, I know Senator Fields referenced the number of bills that were introduced, 600 some, and then 540, I believe, passed. The large number of those were bipartisan and were strong bipartisan bills. I mean, if we were to go back and look at them, where we actually had a lot of disagreement, bills like the public option bill, for example, those were probably one of maybe 24 bills or less. So as a percentage, Colorado, if you just analyze it through the numbers, is pretty bipartisan, and that I definitely saw. One thing that I, to share just a brief story, in my first year in the legislature, Representative Chris Hansen, he's now a state senator, and I were debating a bill vigorously. It was an energy bill, part of the Green New Deal. And I remember I turned and I said, I thought it was our caucus chair. It turned out to be the speaker. They were both short ladies. And I said, just filibuster for a few minutes. Representative Hansen and I have a bill signing we need to run down for. Well, that just shows that we had partnered on a bill together. And it turned out to be a really good bill for the pandemic because it allowed governments to post their meeting notices online. And of course, this was a year before the pandemic. But here we run down because we had worked on this together, and then we ran back up to the House floor and continued on the debate. And that's the way I think it ought to be. I mean, there's a reason why we have parties. It's because there's differences in ideologies. But when I say I love my colleagues across the aisle and in my own caucus, I do mean it. I mean, I truly see them as friends. So I see definitely. Perhaps it's not as warlike as the public seems to think it is, but I see us definitely as being professional, more like advocates in court.
Representative Michaelson Jenet, I wonder, in politics, particularly legislative politics, there's this sort of tyranny of the right now where, everything, you got to kind of deal with what's coming at you. And sometimes it's hard to elevate one's eyes to the horizon. But on the topic of behavioral health in this sort of like maybe not post-pandemic era, but where COVID is endemic, it feels like whether people have been sick with COVID, everybody has been touched mentally with COVID, meaning rates of anxiety are now skyrocketing, rates of depression are now skyrocketing. Colorado's put a lot of policy work into and funding into behavioral health, but I wonder how you are thinking about behavioral health on the other side of this pandemic and how we can support Coloradans' behavioral health then. Thoughts?
Yeah, thanks, DJ. That is the only thing that I am working on right now is how do we manage our state of mental health and behavioral health as a result of the impact of the pandemic and utilizing the one-time funding that we received from the federal government to be able to set up systems where we can take care of this for a long time, not for just, it's not going to be a one and done. So we have a number of things that are coming online it might be next week. Don't tell anybody because it's a secret, that we launch our youth mental health platform where any school-age kid in Colorado can have access to 3 free mental health sessions. Our kids have been disproportionately impacted because for them, this is the first experience in life where possibly their parents lost a job. We had massive numbers of food insecurity that sort of just happened overnight. And how they were impacted, how they were not able to go to school, how their normal flow was impacted has been exceptionally significant. And I'm hearing unofficial reports from our school districts that they're having transports to Children's Hospital every week. I'm hearing official reports from Children's Hospital that at one point last week, not last week, it was a couple of weeks ago, last month, that every hospital in Colorado Springs was on a juvenile mental health divert, meaning nobody within the Colorado Springs metro area could get quick access to behavioral health support in their emergency rooms. So we know that we are seeing this influx in need from our youth, and we're also seeing it from our adults. The other thing that we know is that our response from our adults is going to take a little bit longer to fully flesh out. We have different coping mechanisms. We are on different timelines, and there are different waves that we anticipate of behavioral health impact. So right now, our job, in my estimation, is to look at the system that we have built, to streamline the system we have built, to make certain that we have the gaps in coverage covered. We have many gaps in coverage, both for children and adults. And if we could put those into place, then we should be able to see a far greater result in the mental health and well-being of our state, of the citizens of our state. I want to point out that towards the end of session, Children's Hospital put out declared a mental health state of emergency for our youth. Just yesterday, the National Medical Hospital Association and the American Academy of Pediatrics put out a nationwide mental health alert for the mental health of our children. We have all been impacted. It's okay that we've all been impacted. We don't have to live with it, and we don't have to let it continue to progress in our lives. But if those services are not easy to come by, if you aren't able to get an appointment, if you can't afford to pay for them, then they do you no good. So we're working on that.
Do you mind if I jump in real quick, DJ?
Please do, yeah.
Just to talk about it. Mental health is one of those things that I think about quite a bit, and substance abuse. I mean, we see a lot of it, but the staffing shortages and also the pandemic has impacted our hospitals and then the services we have in place to deal with folks who have long-term mental health issues, not something that's short-term. And that, I certainly have been concerned. I mean, today, IBM Watson Health came out with a study that talked about how when rural hospitals merge with larger healthcare systems, the first things that are cut are things like maternal, neonatal, some surgical care, and then mental and substance treatment. And so what ends up happening is the access to health that we need here in rural Colorado, I'm from rural Colorado, gets cut first. And that's just business, because you want to consolidate services in the next city over. And if someone has to drive 2, 3, 4 hours, that's not easy. So therefore access is denied. And there may not be a transportation mechanism to get there. And so I definitely see, if we don't do something to help keep some of our rural hospitals afloat, it's only going to get worse. 65% of our rural hospitals made $0 last year or had a negative profit margin. And so they're definitely very close. They're having merger talks. They're looking at what they can do. And that was my concern with public option, is that it was based on the reimbursement model that's set up in the CMS statute that already is bad for some of our hospitals. So I think there's a lot of things for us to think about that's kind of tied up with the funding piece.
I want to come back to the public option topic. I want to ask you, Senator, to build on these two previous answers, and specifically, Josh Ewing has a question about workforce development. And given that many members in your caucus are representing rural districts, I wanted to pose this to you. He essentially says 20% of healthcare workers have left the profession, and 20 to 30% of those remaining have considered leaving. He says it's hard to think about while we're still battling COVID, but addressing our healthcare workforce is an imperative for the vitality of our healthcare system. And he is interested in what your caucus what conversations your caucus has had about efforts to retain the current workforce and try to recruit new folks into the profession. Any thoughts on this one?
Who are you targeting? Because we probably all have thoughts on this one.
Yeah, I want to go to Senator Smallwood on this, and then I want to have a follow-up to Senator Fields.
Okay.
So DJ, the question's around healthcare workforce or workforces in general?
The healthcare workforce, and just in general, like, how is your caucus thinking about this question of trying to get people, to come to rural areas in particular, but to Colorado in general, and to work in a healthcare delivery system that is, takes a long pipeline to get folks in, highly specialized, and then immediately feeds into this conversation about compensation and all this stuff that is really not fabulous if you're looking at this 10 years out and wondering if, as a young student, that's really a path you want to take.
Yeah, well, I think that there's a lot to unpack there, as you can imagine. I mean, everything from I think the inarguable fact that Colorado has become a state that's very unaffordable to live in for most people. The healthcare profession, certainly in its entry levels, is not an extremely high-paying job right out of the gate. When you look at the average compensation of, let's say, a CNA, for example, these are necessary roles, necessary occupations, and most places across the state, certainly urban and quickly growing rural, are becoming a tough place to afford to live. Everything from home prices and rent, and now the problem around things like fuel prices, affordability of vehicles, both new and used. So there are forces far beyond the four of us that are creating situations that make Colorado really, really tough to live in. I know our caucus is doing everything we can to address that specifically. We'll have an entire package of bills to address affordability, and tying into that fairly closely, affordability of education, because a lot of these professions that we're talking about do require, if not degrees or advanced degrees, certainly some level of certification, registration, licensure. And then to pour gas on the fire, you've got a lot of the healthcare occupations are now facing things like vaccine mandates, where my email inbox is flooded with folks saying, I work for this health system or that health system, and now I'm because of a condition that I have that doesn't allow me to be vaccinated, or where I don't feel that it's safe to be vaccinated, or I just had COVID and I've read that I'm not supposed to get vaccinated within X amount of time after that. So there is a lot of different issues around that. Again, we'll start with the affordability of the state of Colorado, the ability for people to get into the healthcare occupations without necessarily these advanced and very expensive levels of ongoing education, and kind of see where that takes us.
Senator Fields, I wanted to ask a follow-up here, connecting workforce back to the equity lens that you mentioned in your opening comments. I think it's hard to get people healthy and well unless they have caregivers that look like them. And
right.
Across all demographics, except for Caucasian, all demographics have fewer caregivers as a percentage of the workforce compared to the percentage of the population that they, the share of the population that they have. So what are your thoughts on how we might get more people of color into the workforce pipeline so that we can meet them where they are and get them where we need them to be?
Well, I think we need an integrated approach, because we need to make sure that we have a trained public health care professionals that are at every corner across our state. And we have several models that are already in place, like Anschutz. When they do their recruiting, they help some of their new doctors with a down payment on a housing. They support scholarship and loan reimbursement. So there's things that we already do, that we've done for teachers, that we've done for nurses. And I think we just need to kind of turn it up a notch and making sure that we're doing everything possible to shrink that gap, because I am hearing a sense of stress. First of all, I want to thank all of our healthcare providers that have been on the front line during this pandemic, because we wouldn't have made it through with the people that created the vaccine, to the doctors and the nurses and the wheelchair pushers and patient movers, and just everyone that works in the hospital. I really want them to know how much I appreciate their service. And you're absolutely right. It's hard to become something that you don't see. So if you don't see a Black teacher, it's hard to want to be a Black teacher. If you don't see a Black doctor, it might be hard to become a doctor. So we need to make sure that we are advancing diversity and equity in every single skill. Now, the shortage that we're seeing in healthcare is what we're seeing in restaurants. We're seeing a shortage of teachers. So we need to be addressing the workforce pipeline on every single level. That's why I'm advocating for an integrated approach to make sure that we don't have a shortage of skills as we move into next year and the year beyond that. And so it means we have to work upstream. We need to make sure that we're preparing our kids to take their place in our economy and society while they're in school, giving them the skills that they need.
So Senator Smallwood, if we sort of put this labor shortage that Senator Fields mentions, and we've been talking about in some broader context, how are you thinking about, how is your caucus thinking about the broader Colorado economy? In some places it continues, it's getting pretty hot, and in some places it continues to lag. It fits within a national conversation, obviously. But the state of the economy, labor, inflation, all of these things that some of which are out of our hands or out of your hands are going to be, I think, topics of conversation in the next session. How are you thinking about Colorado's economy in general?
Well, the pre-pandemic economy or the post-pandemic economy, BJ, because the two were sort of polar opposites.
Yeah, I mean, I think, if we're putting ourselves in the shoes of Colorado and July 1, 2022, and you're thinking ahead during the session, I'd say, maybe the endemic COVID rather than pre or post, the endemic COVID economy.
Yeah, well, and the reason I asked is because it still doesn't feel to me, or to certainly the constituents that I serve, that we're on the other side of the pandemic, really. And the decisions that we make are sometimes frustrating as a legislative body, because it appears that not all of our colleagues, I'm sure none on this call, but not all of them have really focused on trying to get people 100% back to work and doing the types of things that motivate industries to grow and hire. I mean, we still see, and I'm not saying these are all bad, but we see these burdens placed on businesses, particularly small businesses, that again, aren't all bad. Things like paid family and medical leave, things like the changes around our oil and gas industry, things like a new tax on health insurance in our state. All of these burdens make it that much more difficult to get things kind of restarted and kickstarted in the economy. And then you pile again on top of that things like very high energy prices, fuel prices that are the highest that we've seen in years. It is still primarily, in my opinion, because of the legislative and regulative environment, very expensive to build in my backyard here, for example, new multifamily for sale properties. So we continue to see a housing shortage, maybe not so much in the expensive single family homes, but certainly for those in multifamily. And a lot of that is driven by the regulations that are built here around the state of Colorado. So in the minority, I'm not sure that everybody shares my opinion with it on some of these items. So I think it'll be a tough legislative climb to do things like going back in around the construction defect laws, for example, and continuing to try to make it more easier to build things like these more affordable multifamily homes. I think it motivating the oil and gas industry to want to come back into Colorado, to create new production here, to do our part to keeping the United States energy independent, keeping fuel prices low. We'll do what we can in the state here, but first of all, we've got, I think, stop the offensive against industry, and we're still seeing some of that. And it's like death by 1,000 cuts. A lot of these are not cataclysmic if you look at them in a vacuum, but you pile all of these regulations on top of each other, pile all of these taxes on top of each other, and it gets to be really, really tough, I think, to attract new business to come into our state, and the existing businesses to want to not only stay here, but stay here and grow.
So Representative Michaelson Jenet, how about your caucus, House Democrats? Do you think this is a time to, in 2022 in the legislative session, is it a time to kind of slow the role of economic activism, or is it even more imperative given all that has been experienced in COVID from the view of your caucus to power through with greater economic policymaking?
Well, I certainly can't speak for all of my caucus. We're definitely not a group of people that walk in lockstep, but I can tell you that the conversations that we are having are surrounding how do we get people back to work, and what does that look like? And you read that 20% of the medical workforce has left. We're hearing that it's actually 30% that has already left the workforce. And so we're starting to look at ideas of how do we bring those people back in? How do we give them an opportunity to talk about the experiences that they've had and to help us figure out how to set them up for a better, healthier, safer medical experience if we can bring them back into the medical workforce. And if not, how do we retool them for somewhere else? We're not going to be able to draw in our workforce from outside of our state. And I don't think that we should draw in our workforce from outside of our state. We have a robust population in Colorado in rural and urban parts of our state where we can reach directly into our communities and work with people to level up their earning potential. And I believe that highest and greatest use of some of that ARPA funding is going to be used directly to elevate people's earning ability and financial security in our community. That's the focus of our conversation.
Senator Fields, I want to shift gears a little bit and ask you about the public option legislation that I guess tell us what you think. Is that public option legislation still a public option? Is it the sort of how politics and legislative politics works? So you get half a loaf sometimes? Is it the kind of thing where you got to go back? The plan is to go back for more and another bites at the metaphorical loaf. Give us your sense of that sort of public option fight and how it turned out.
That public option bill was a tough vote for me. It was really tough because it was somewhat complicated. And when I think about my constituents, the residents in Senate District 29, I didn't really see where they would benefit from it. So I struggled with it a lot. I debated it a lot. I asked a lot of questions. At the end of the day, I did support the public option because I believe in access. I think that, health insurance is like a right and everyone should have access to it. And a lot of times we don't get things right down there. And so we always kind of come back and tweak it a little bit to make it better. But my goal is always to try to get it right the first time. So that's my opinion on public option. Is kind of a wait and see because it has not been fully implemented yet. And so I'm on a wait and see mode right now. But I'm quite sure that Senator Smallwood might have some additional thoughts on this because I think that we had some common questions as it related to that bill.
I want to come back to you here in a second, Representative Soper, but Senator Smallwood, since you've been name dropped here, do you have any thoughts on that bill?
Yeah, I mean, we're going to spend a long time sort of mopping up the effects of that particular piece of legislation. And I really appreciate Senator Fields' comments about that. Not only do we serve in the Senate together, but obviously we're on the Senate Health and Human Services Committee together. So between the senator and I mean, we spent hours both in committee, on the floor, and hallway conversations about what this thing should ultimately look like. And she and I share a lot of the same concerns, a lot of the same frustrations. At the end of the day, that what's going to happen out of that bill is it's going to end up being a political wisdom, and that's about it. It's going to end up being a rate setting bill. I've said that on the record multiple times. For those who what the plans within this Colorado option are actually going to look like. Now, granted, these are only drafts, a starting point of where we might be at. But DJ, a silver plan in the state of Colorado under this is proposed today to be a $5,000 per person deductible, with a maximum of $8,500 per person. This is what I was worried about. This is what I expressed concerns about during this is, a silver plan is a silver plan and a bronze plan is a bronze plan. And how these particular programs are doing anything towards affordability lower deductibles, lower copays, lower out-of-pocket maximums. Candidly, we're just not seeing this. So at the end of the day, what will happen is the carriers won't be able to meet the rate goals that were put into law in the state of Colorado, and therefore the hospitals are going to get rate set in our state. And we'll see what happens when that happens. You know, we think we have a healthcare workforce crisis today. Well, what happens when hospitals aren't allowed to charge what they're charging today? What's the workforce going to look like at that point in time? So I appreciate the work that my colleagues on the other side of the aisle did to make it to where individual practitioners aren't lumped in with this rate setting. Mercifully, you know, we were able to take athletic trainers and podiatrists and audiologists out of this rate setting that was going on there. Thank goodness. But I'm still really concerned about this, and I think this is going to take a really, really long time to unwind before the real negative implications of a lot of this.
So Representative Soper, let me just sort of ask this kind of philosophical question that ties in some of the standard ideological differences between the parties and then this particular bill. If healthcare were a pricing and cost problem that was solved by the market, it seems to me that it would have been solved already, or we would have had more progress. And so if the market can't do it on its own, if it requires some policy support to get our hands around cost, what does that look like from the view of a Republican House member? How do we think about policymaking in terms of cost control? And do you think that the market has not yet proven itself worthy, or is it just that there's been too much regulation that has obstructed the market's ability to solve this?
Thank you. That's an easy question. I'm joking. That's probably one of the most difficult questions out there.
Yeah.
I mean, healthcare for a long time in this nation has been a highly regulated industry, and that's also what's made the cost side of things very, very complex. I mean, we've created this Gordian knot, and if we could easily undo it, we would have done it by now. The era of going to your doctor, and if you couldn't pay with cash, you would pay with a chicken or what other merchandise you might be selling, is long gone. And the ability to directly negotiate as a patient certain prices, or to even find out what the price is of a procedure before you even have the procedure, is like pulling teeth.
That's right.
Yeah, like last year I had to have a hip surgery, and I remember asking the question, how much will this cost me? And no one could give me an answer. No one. I mean, if we could rebuild the American system, I mean, I'll tell you, if I was like king for a day, or someone who could make everything happen, I mean, it'd be much more like a supermarket, where if you're buying a can of soup or a jar of milk or a watermelon, there's a fixed price, and it doesn't matter if you're paying with a credit card from Visa or MasterCard or Discover or American Express, or you're paying cash. There's going to be a similar price for that service, because I can tell you from sitting on a hospital board that there's a price I know that it costs us to deliver a service. And I would like to engage in regular business, but then I also know that 75% of our customers or our patients are either Medicare or Medicaid. So it's a very powerful player who's already set a price that they will pay. And some of those prices are actually below the costs that it costs us to deliver the service, which means we have to engage in what we call healthcare economics. So we charge the commercial payer more. And so that's why commercial care is going up. So in many ways, if the government paid their fair share of what it actually costs to deliver some of these services, we could in fact lower the commercial side. That would just be one example. I don't know if I quite hit on your loaded question there.
Well, I appreciate you taking a stab at it, and I appreciate the just offering your sort of thinking about that. That's really the question I was hoping to get at, is how do you sort of approach that? We're getting close to time here, and I want to give each of you an opportunity to sort of address this kind of last question of what gives you hope? What gives you hope these days when it comes to politics, to healthcare, to the work that you're doing what gets you out of bed and, gets you sort of one foot in your pants at a time, so to speak, or and keeps you going. So Representative Soper, since I gave you such a tough one there, let me ask you first, what gives you hope when you think about your job and shaping policy today in Colorado?
Well, when I wake up in the morning, I'm always excited because I have the best job in the world being a state representative and representing the folks back home. And I know these are complex problems, but I also know that collectively we're able to solve them. I mean, we created them, so we should be able to solve them. And that really just trying to sit back and say, okay, what can we actually do to be able to effectuate positive change? And that's something that excites me. I know we don't have all the answers, but I do feel like we are chipping away at the problem of why is it so expensive, or why are people leaving the industry? But it does take us talking more.
Representative Michaelson Jenet, how about you? What gives you hope as you tackle this job of policymaking in Colorado these days?
It's so funny that Representative Soper ended with, we need some talking more, because what I was going to say is that actually I feel like in our chamber, I echo the sentiment of Representative Soper that this is the best job I've ever had in my entire life. And I know if I have a question that I want to find a different perspective on, if I go to Senator Smallwood, he's going to sit down and talk with me. If I go to Representative Soper, he's going to sit down and talk with me. And, of course, Senator Fields is going to talk with me. But, we always are looking at this kind of belief that there can't be any functionality across the aisle. And I have not experienced that in our chamber. Does that mean that it can't happen, that there is that inability to work with one another? No, we're all human beings. Of course that happens. But for the most part, what gives me hope is that here in Colorado, I feel like we have been able to make some really incredible bipartisan pieces of legislation that have made life better in Colorado. And we have a very long way to go. And I have the hope and belief that we'll be able to do it together, not one party over the other, but together.
Senator Smallwood, what gives you hope these days?
Is this the part where I'm supposed to say this is the best job I've ever had?
I'll leave that to you.
Well, it is an honor to serve. That is for sure, and definitely an honor to serve the citizens of Douglas County. I love my colleagues at the Capitol. I try to go in with a smile on my face and know that we really have done good things. The 5 years that I've been there, I mean, I've seen great strides in healthcare policy when it comes to things like transparency, when it comes to the issue that we had, particularly around some pricing issues in a lot of the suburbs here. I'm glad to see the federal government finally step in on the surprise billing issue. It's something that I've been fighting in my career for almost 30 years. The mental health parity that we're seeing that Representative Michaelson Jenet talked about is really important, kind of destigmatizing that other part of healthcare that puts a lot of strain on our system. So that's what gets me up to know that we do seem to be moving the ball forward. And as importantly for me, as I would say, a self-proclaimed hater of the idea of single-payer healthcare, and I'll say it every opportunity I get, I think it's the worst thing that could happen in our country. I grew up in Germany. I've had family members die under single-family government-sponsored healthcare. I think it's the only thing as bad as the government making decisions around your health is the way we've got it set up today, where your boss does it. So there's still a lot of room for additional work, in my opinion, on stopping, and I'll do this till my last breath, stopping those people that really, truly, in their core, feel that the government is the right organization to be making decisions around your healthcare. So that's what gives me hope, is looking in the rearview mirror, seeing the stuff that we've done, and looking forward into the windshield, knowing that somebody still has to be sitting in these chairs to make sure that doesn't happen, at least not in my lifetime.
Senator Fields, will give you the last word. What gives you hope as you think about policymaking in Colorado?
What gives me hope is every day when I wake up, I get the opportunity to look at the blue sky, that I have access to open spaces, that I have access to my neighbors and their kindness, and helping them deal with some of the challenges and the barriers that they encounter from day to day. So what gives me hope is the people I surround myself around and the opportunity to serve the great state of Colorado. What I love about serving in Colorado is we do get the work done. We're not like Congress. We really do get results for the people. And that is really refreshing. It's exciting to know that we're doing good work for the people.
The last word, Senator Rhona Fields, Chair of the Senate Health and Human Services Committee, Senator Jim Smallwood, the Chair of the House Minority Caucus, Representative Dafna Michaelson Jenet, the Chair of the House Public and Behavioral Health Care Committee, and of course, the inimitable Representative Matt Soper, who held down the fort last year for us. I appreciated that on the Republican panel. The Vice Chair of the House Committee on Legal Services. Thank you all for doing this and being with us. I appreciate it. And for all of you who are here in our audience, I appreciate you guys watching and putting the wind in our sails. Again, your support of this conference is what funds our reporting the other 364 days of the year. I appreciate, like I say, just being with us, showing up, putting wind in our sails, and helping us to make this happen. So from all of us here at State of Reform, to all of you, thank you very much. And I am crossing my fingers and holding my breath that we will be in person next year come heck or high water. So we'll see you then.